Yeah, I would have assumed that. I'd assumed that because of this, everyone's mental health would deteriorate, things will be getting worse for them, but it's being a bit mixed. Of actually being able to thrive.
Hey Lawrence.
Hey Josh.
I've been thinking about the podcast. How about in the first series we focus on the pandemic?
Yeah, and in each episode we can ask our guest how it's been affecting them and what they do.
We could ask people to join in with the hashtag #PosNegative.
How would we introduce it each week?
We'll just say, welcome to Positive Negative.
In today's episode, I'm going to talk with Lee Allen. Lee's been a friend of mine since senior school, and he's now an occupational therapist for the NHS. I chatted with Lee on the evening of April 8th, and in this episode we discuss how his work and those he cares for has been affected by the current pandemic. The way Lee supports his patients had to drastically change overnight, and it's possible that he'll be required to change roles and hospitals to support his frontline colleagues in the NHS.
Okay, so my name is Lee. I'm an occupational therapist for the community mental health team in Portsmouth.
And what would your day-to-day be? What, not now necessarily, but what would it usually consist of?
Yeah, so my usual days, I work with all adults, sort of 18 plus. The normal conditions I work with is depression, anxiety disorders, people with psychosis, like schizophrenia, people bipolar, people with personality disorders. My particular role as a occupational therapist is looking at how their mental health symptoms are getting in the way of the everyday activities that they do that are important to them. So, for instance, that could be because of their low mood, low motivation, high anxiety, they're struggling to go to work and manage the demands of work. Or it could be that they have children and they're really managing to manage the demands of being a parent. It could be they're just struggling to manage their own home environment and their home's kind of hoarded. So a lot of my job will be going out to see people in their homes, figuring out what areas of their life are being impacted by their mental health and physical health as well in that as well. And then set up a goal, set up some plans, and work with them weekly to try and sort of get them back into work, get them on top of their problems in their home, get on top of being able to keep their children so they don't go into the care system. So that's kind of my usual day at the moment.
And what kind of impact has Corona and COVID-19 had on you, but also the people you work with?
So a big impact. So all of my patients I tend to see in their home or out in the community doing sort of social integration, getting people out and about, getting them functioning in their usual environments. And that's just being impossible at the moment. We've had to kind of cut back our sessions in the mental health team to just doing either video phone calls or doing using like Zoom, Skype and all the sort of the digital video options of talking to people. It's okay in terms of just keeping a dialogue going, checking how they're doing, helping them solve a few problems. That means treatment's kind of being put on hold. A lot of the goals and things they wanted to achieve can't happen anymore. And so just at the moment I just been calling my patients once a week, seeing what they're doing, if they're getting shopping in the house, if they've got any friends and family, how they're sort of managing a situation, and had to put these kind of like bigger goals they wanted to address on hold.
And what would you say, I don't know, what is the kind of, mood or atmosphere, I don't know what the right word is, coming from them? Is it making obviously it'd be making their mental health worse?
It's really interesting. Yeah, I would have assumed that. I'd assumed that because of this, everyone's mental health would deteriorate, things will be getting worse for them, but it's being a bit mixed. There's been some of actually being able to thrive in these situations because a lot of their difficulties, like a common problem I work with people agoraphobic and tend not to leave the house, and a lot of that's fueled by social anxiety, like fear of crowds, fear of bumping into people, having to speak to them, feeling judged, feeling they won't be able to cope. So having the social distancing, people having to keep apart, public transport being a lot quieter, shops being a lot quieter, these patients are actually now finding the confidence to actually have a go at integrating back into the world again and not feeling as stressed as they usually do. So that's actually being one of the few sort of silver linings in the clouds here, is that some patients are getting the benefits of perhaps the social distancing.
Wow, that's really fascinating and something that I never would have thought of. I just
I
assumed,
didn't predict it either, no.
yeah, would have just assumed it was bad. So those people, they're going out for their like hour a day walk or exercise and
Yeah,
really liking the
so
world.
exactly. Normally going to a supermarket is a big deal for a lot of my patients. A very stimulating environment. There's a lot going on. Just walking down the road or going to corner shop could be difficult, but this has been an opportunity for people to be able to either just go on for walks in sort of in the park, or sort of down the local street, down the local high street. But sometimes, yeah, taking a chance of actually going to a shop and having a go at that, which is it's great for work I'm doing. So a lot of my work is actually having a go at doing things and then getting people to recognise what thoughts they've been having, what emotions they experience, how they physically feel it. And I can only do that if I actually expose them to these very difficult situations. And because they have been exposing themselves, at least that's information I can get from the patient and help them learn about their mental health problems, learn about their anxiety. However, on the flip side, there are patients that have deteriorated as a result of what's happening, as what we would have expected. So that may be because their support networks are shut down. They're not able to get that kind of emotional support from their family. They may have carers that come in that can't, because the care industry is so short-staffed at the moment and really limited to what visits they're willing to do, and taking urgent cases. Housing departments can't help the patients because they're also limited on what amount of contact they can have. So adaptations aren't being made to people's homes. So yes, a lot of patients have definitely gone downhill because they haven't got that access to the facilities they need, or because they're more isolated than usual, or just because they're so anxious about becoming unwell.
Mm. And what, I don't know, how do you see that progressing in the future? What, like, especially if this goes on for potentially months, is there, I don't know, is there a light at the end of the tunnel for any of that, or is it just take each day as it comes?
At the moment we are because at the moment I guess we're fortunate that we can run a mental health service to some degree, that we're still being able to have regular phone contact with our patients. We're still taking new referrals and assessing them over the phone or over video, and being able to give medication advice or get medication set up. But if our current inpatient hospitals that are taking most of the corona patients in for medical treatment, they're likely to get completely overflowed. They won't have enough beds, and so it'd be down to other health providers such as like mental health services to actually be redeployed and to provide kind of inpatient medical care in any building we can find to do that in, be it local leisure centres, be it old hospital buildings that are being shut down, reopening, and that will then look very different because we won't be able to offer the contact to patients. And I really worry about the mental health of just the general population actually becoming a big problem. I really anticipate, even once this is all over and services resume, to be an influx of mental health referrals, because the amount of work people having to do to cope with this and being cut off from the world for so long.
Is that going to impact on your work? Is your job role going to change? Are you going to be relocated to different areas?
Yeah, so at the moment we're just kind of giving our bosses, our managers, a list of the skills we've got, what experience we've got, and there's a good chance we will be redeployed into roles that are really unfamiliar to us. Like I've been doing mental health for about 8 years now in my current role. And so to go back into working in a more sort of physical health role would be quite a change for me. And to manage that, we are getting upskilling training. They are teaching us kind of the basics of going back into that work, sort of refreshing our minds to get ready for that role again. But yeah, it's very anxiety provoking. I think we all like to know what role we're going to go into in our work, and be doing things that are familiar to us or that we're confident in our skills. So being sent somewhere that's not so familiar or a bit out of practice is frightening.
Plus, I guess there is more than usual. There's a greater risk to yourself doing these jobs as well, because I mean, there's a risk to anybody now just going outside and coming into contact with other people, but you'll be on the front line.
That's my biggest worry, yeah, because I guess I've been fortunate in this role that mostly it can be done by telephone, by video call. In urgent cases, we would have to see people face to face in their homes, but that's being put to the bare minimum. But if I was to work on the front line, I'd be then exposed on a daily basis, to patients that are carrying the virus, and there's a good chance of me bringing it home to my family, which is my biggest fear. Because my wife has problems with asthma. She needs like steroid treatment. I'm worried what would happen to her to COVID. My daughter's only 1. I have no idea what underlying health condition she's got at the moment. Hopefully none, but that's impossible to know. So I'm really worried about working in the front line, and especially if there isn't the equipment to protect us the way it should do.
Yeah, I can't imagine what that worry is like for you, actually. How is your mood generally? How are you feeling day to day?
Yeah, it fluctuates. So I think some days I can be really kind of optimistic and hopeful. I'm really amazed by the work that's already being done, and the amount of people that have volunteered to be able to help out services that are struggling, the amount of support the NHS has been getting from the general public, the steps taken to kind of like manage the progression of the virus and hopefully reduce the pressure on the NHS has been great. So I can feel hopeful. Then other days I feel overwhelmed, have this looming sense of dread, this sense that it all could go really wrong, and I won't be able to cope, and I won't be able to help people and let everyone down, and so it can really fluctuate day to day. And I think just being trapped in your own house for the majority of the day, that you get tensions within the home, like both me and my wife can be a bit tense. So yeah, it's a bit of a roller coaster at the moment. But for me personally, it's just not knowing what's going to happen next is the most difficult bit, and how things are going to pan out.
Has it? I mean, I guess your child's so young anyway, but have there been any like funner moments because you're all kind of stuck indoors? Is there any sort of, I don't know, reinventions that you've done to change up how you are?
Yeah, so I think a big part of my professional role is by being communicating to my patients about how to structure their day, considering that there are these social distancing rules, that there is a lot of isolation ahead for us, and it's so important that we have a real mix of activity in the day, that we're doing activities that are quite productive, so working on perhaps projects and goals that we've let go. Like for us at the moment, our garden has been neglected for a long time, so we've ordered paints for it. We kind of set up on the compost barrel. We kind of started to grow vegetables in our garden, and our garden's been just a nothing bit of land for ages, and we haven't been able to do anything to it. So that's been really nice. So yeah, having those productive activities, but also having sort of leisure time, so finding novel ways to kind of entertain ourselves, and so doing craft projects, making cards for relatives to kind of lift their mood up, making videos and pictures of my daughter to send to the grandparents, teaching my mum and dad to be able to use Skype so I can communicate with them as being a challenge, but it's great because now that they've got that and they can see their granddaughter, and making sure we fit like kind of new exercise in. So many options on YouTube at the moment of how to stay fit at home, and I've had so many Netflix programs added to my wish list, and I haven't had a chance to watch them. So it's been great being able to do that. So yeah, there's been ways to get around it and make the best of the situation.
That sounds really good. I'm glad the garden's coming together as well. That sounds like a fun project. Are there any, I suppose you touched upon it a bit earlier, with some of your patients being able to go outside and the social distancing is really helping them. Are there any other like inspiring stories that you've seen since the start of the pandemic?
For me, not particularly necessarily individual stories, but what I'm really excited about is the increased use of digital technology. Like the NHS is, well, especially where I work, we've been talking about the use of digital technology for a long time and desperate to kind of get it going, but it's always kind of been in the background. It's never been pushed, but we've been cornered and we've had to push forward and find ways to be able to communicate with our patients, but being able to see them face to face, because you can't do a mental health assessment if you can't see the patient and see what their mental state like, how they're coping, how their situation's looking. So I'm really excited that there's been a lot of use of digital technology such as Zoom, such as Skype, and people getting more confident using it. Like older people, like my mum and dad, can communicate. My wife's parents, patients at work. I was able to do like an environmental home assessment of the patient by him just having me on his phone and taking the phone around the house, and I could work out what equipment he needed in the home so he could get on off the toilet, in and out of the shower. And normally I'd have to go into the home environment. Being able to set up meetings with different professionals and the patient immediately rather than having to organise different appointments. So I'm really excited about how digital technology is going to jump forward as a result of what's happening at the moment.
Do you think some of that stuff will stick and be used again once life returns back to normal?
I hope so, because I think people were put off by it because it's something different, something new, and they're nervous about it. And I think we would have delayed and found reasons not to. I think now that we've done the hardest bit, which is given it go, had a start on it, people's confidence level is going to be a lot higher, and they're going to start to see the benefits of how actually we can set up meetings, joint meetings for our patients a lot faster. One-to-ones we'd probably still try and meet up with people because we need that contact with people. But imagine if I could go to a patient's home and they're concerned about their medication or concerned about their medical health, and I could get a doctor up then and then on a sort of a digital communication, and they could do an assessment there and then. It would make such a difference.
Yeah, that sounds fantastic.
It's exciting.
Are there any other ways you hope it would shape the future?
For me, living in Portsmouth, it's a really polluted city. It's because we've got a really high population considering our size. We're one of the densest populated cities in Europe. And so pollution is poor, and they've done sort of carbon monoxide readings, and they shot down even after only a few weeks of the shutdown and sort of social isolation, which is brilliant news. It's lovely not seeing lots of cars on the road. People, I think, are getting back into like walking their dogs again. I've seen dogs being walked down this road I've never seen before. So people are using this opportunity to perhaps get the confidence doing things like that again. So I'm hoping people will continue to perhaps live slightly more healthier lives, get more used to using local resources rather than driving out of the area, and finding ways to keep the pollution levels down, sort of enjoying the fact that we can see the stars at night a lot better, that we can hear the birds around a lot more now. It's great.
That's fantastic. That's really great, Lee. That's everything from me, unless there's anything else you'd like to say that you haven't spoken about or got a chance to say.
No, I think that covers it all. Thank you. Yeah.
Awesome.
Else.
Thanks very much for coming on.
No problem.
Thanks for listening to Positive Negative.
Don't forget you can follow us on Twitter at PosNegative or find us on Facebook.
And join in the conversation using the hashtag PosNegative.
You can help us to grow by leaving us a review and sharing this episode with your friends and followers.
You'll also find links to what we've talked about in the show notes, or by visiting positivenegative.com.